Hello, everyone. We're Chris, Samrit, Jap, and Lisa, and the alternative imaging modality topic we are presenting today is the nuclear medicine imaging. For the presentation today, we will be discussing what nuclear medicine is, how the image is obtained, what the professional collaboration process looks like, and how it compares to conventional dental radiography. So what is nuclear medicine? Nuclear medicine is a medical specialty that uses radiopharmaceuticals to diagnose and treat various diseases. These radiopharmaceuticals, also called radiotracers, consist of small amounts of radioactive material combined with carrier molecules. Nuclear medicine imaging is the application of nuclear medicine to produce two-dimensional or three-dimensional images of bodily structures. These can include both hard and soft tissue structures. So pause the video for a second and try to think of what type of structures you think a dentist or a dental hygienist might want to see using the nuclear medicine imaging technology. Some possible answers you may think of include temporal mandibular joint, tumors, and bone levels. I will now let Jap take over to discuss the application and how nuclear medicine imaging is obtained.
Thank you, Lisa. So to produce an image, a solution containing the radiopharmaceuticals are introduced into the body through ingestion, or inhalation, and uses radioactive tracers to produce images of the body for diagnostic purposes, which I will discuss shortly. The most common radiotracer is F18 fluorodeoxyglucose, otherwise called FDG. FDG is similar in structure to glucose and is taken up by cells along with glucose. More metabolically active cells take up more FDG. This concentrates the radiotracer into the targeted structure where it emits radiation, which is detected by the special sensor called a gamma camera. So there are different solutions that are designed to be attracted to specific organs, bones, or tissues. Once the tracer has reached the targeted structure, the gamma camera then detects the gamma radiation emitted from the radiotracer in the body and converts it into an image. A nuclear medicine specialist then uses the image to help understand the structure and functioning of the targeted tissues. For example, physician uses this image to understand the functioning of organs and tissues. A dentist might use this to diagnose and evaluate the health of jaw bones, temporomandibular joint, or to check bones for fractures, infection, or arthritis. Next, we will talk about nuclear medicine imaging equipment. So the first one that we'll talk about is gamma camera. It detects the energy from the radiotracer in your body and converts it into an image. It does not emit any radiations itself and has radiation detector called gamma camera heads. The second one is single photon emission computed tomography, which produces a series of images that can be reconstructed into a three-dimensional image. Nuclear medicine imaging equipment also consists of PET, which is a short for positron emission tomography. It is a large machine with a round, donut-shaped hole in the middle and detects the energy from the radiotracer in the body. At last, we have the image fusion, which allows the doctor to see the information from two different exams in one image to provide a precise diagnosis. I will now pass it on to Chris, who will discuss some of the further applications of the nuclear imaging.
For medicine, nuclear medicine imaging can show metabolic hotspots throughout the body and in either hard or soft tissues. This would allow medical doctors to find any areas of abnormal cell metabolism, including tumorous growth or systemic autoimmune activity, such as rheumatoid arthritis. In dentistry, the imaging is typically contained to the structures of the head and neck. Some examples of what nuclear medicine imaging can show us are tumors and precancerous growths within the bone, melange, rheumatoid arthritis of the temporomandibular joint, and soft tissue tumors and precancerous growth in the oropharynx. Question for the audience. Does anybody remember what MRONJ stands for? Is it medical reformation of oral and nasal joints? No, it's medication-related osteonecrosis of the jaw. Which medication is most often associated with MRONJ? That's right, it's bisphosphonates. Many imaging centers combine nuclear medicine images with computer tomography, or CT, or MRI, magnetic resonance imaging, to produce special views. Doctors call this image fusion or co-registration. Image fusion allows the doctor to see information from two different exams in one image. This leads to more precise information and more exact diagnosis. Some imaging units can perform nuclear imaging diagnostic scans at the same time as other imaging modalities, such as SPECT CT combined with traditional CT, and PET combined with CT, or PET/CT. PET MRI is an emerging imaging technology and is only available in some locations. When these images are combined, the